I'm James Hackney, Assistant Professor of Physical Therapy at Missouri State University. In this video, we'll be demonstrating some of the material that we cover in our continuing education course, Returning Full Force Advanced Sports Rehabilitation for the Lower Body. Let's discuss a very powerful modality in sports rehabilitation and training of the lower body, plyometrics. First, let's define what plyometrics are. The expression is a construction from Latin. Plyo comes from the word increasing, and metrics comes from the Latin meditar, which means to measure. This type of exercise is characterized by rapid eccentric muscle contraction followed by explosive energy return from the limbs. What makes this energy return possible is the mass spring characteristic of limb control. For a healthy, neurologically mature person, the legs behave like large linear springs. The greater the leg spring compression, that is, the more the lower body joints flex as a result of the force applied upon them, the greater the potential energy return upon recoiling of the leg springs. So why should we include plyometric training for patients planning on returning to sports or activities such as running? There are a few reasons. One is specific adaptation to imposed demand. This type of motion, rapid eccentric contraction followed by explosive energy return, takes place in most sports. Therefore, practicing it as a part of the rehabilitation program helps to ensure that our patient athlete avoids motion patterns which predispose him or her to injury, and also helps to improve the ability of the neuromuscular system to take maximum advantage of the mass spring characteristics of limb control. When an athlete begins plyometric training, especially in cases of rehabilitation from injury, there is a progression of skills which build upon each other. First, he should master the movement statically in order to learn the correct alignment of the limb segments, and next practice them at slow speed to demonstrate dynamic control of the movement. These first two stages are also called the strength building phase. The final phase involves high-speed movements. This resembles the usual speed of sports-related movements, stimulates muscular hypertrophy, and improves the neuromuscular ability to return force. Once the athlete is doing high-speed exercise, another aspect which we may advance is the number of planes included in the movement. It's most appropriate to start with uniplanar motions such as hopping in just the anterior to posterior or lateral directions, and then progress to a combination of both those directions, and then progress to vary the vertical dimension. Another important way that you can manipulate the demand of plyometric exercise is through the surface. Most of you are probably familiar with how doing weight-bearing activities, such as running, on a soft or unstable surface, such as sand, increases the neuromuscular demands of providing stability. However, it also decreases the velocity of the eccentric muscle contraction associated with plyometric exercise. Therefore, if you are rehabilitating an athlete from a musculotendinous injury, such as Achilles tendinosis, one way which you could decrease the tendency for the exercise to aggravate their injury would be to do the exercise on a softer, energy-absorbing, or damping surface like dry sand. Chad is going to help us demonstrate how one might progress a patient-athlete into plyometrics. Since some variation of the squat position is the most frequent position during leg compression from landing, a hop or jump, this is where we will start. In the trunk, the athlete should maintain some lumbar lordosis. This both helps to protect the passive posterior supporting structures, such as the posterior lumbar ligaments, and allows the trunk extensors to store and return energy during plyometric exercise. The hips should be flexed, which allows the hamstrings a better length-tension relationship to resist anterior shear force being applied by the quadriceps. The most anterior point of the patella should not be forward of the toes, because if they are, it would cause an excessively high patellofemoral compressive force during the high-speed exercise. It is also important to learn and maintain optimal alignment of the legs and feet in the frontal and transverse planes. As the lower body joints flex during the squat, It is best to minimize the pronation of the feet, which can be seen as a valgus inclination of the heels. Also, make sure that the knees are not deviating into valgus. With most people, you can watch and instruct your patient to make sure that the knee remains pointing over the second and third toes. Although if a patient athlete has external tibial torsion, you will not be able to use this visual cue. Once your patient athlete has demonstrated the ability to maintain alignment in a symmetrical posture, then you can progress him or her to an asymmetrical posture. Ensure that all the alignment issues on which you had worked with the symmetrical squat are carried through to the asymmetrical squat. Once this is achieved, you can progress to doing the exercise dynamically. Watch carefully to be sure that the proper alignment, which we discussed a minute ago, is maintained in both the sagittal and the frontal planes. The next phase in the progression is called the amortization phase. In this phase, the patient athlete hops or jumps and lands at full speed, but instead of bounding back up to release the energy of the leg springs, he holds the position isometrically. This helps him learn the alignment and helps you to evaluate his ability to do so. Finally, if your patient athlete is able to perform the amortized exercise with good control and alignment, he may progress to carefully dosed plyometrics, first uniplanar, then multiplanar in the horizontal dimension, and finally you may add a vertical component.